So, hello everyone. My name is Victoria, and I keep interviewing Canadian students to let you know more and to give you more information about studying in Canada. Today, I'm very excited to introduce Emindo. He is a Canadian student of one of the best Canadian universities, and maybe even the best one this year, University of Toronto. And Iminda is a medical student, which is even more exciting. So, Iminda, hi, how are you today?
Good. Thank you for having me, Victoria, and I look forward to sharing my modest insights with your colleagues.
All right, so Minda, so first of all, I've heard that the competition among students who want to enter into any medical schools in Canada is enormous. What could you tell us about that at first?
Well, you have heard correctly. As with all countries in the world, medical schools tend to be one of the more desired destinations for post-secondary education. And so, yes, it is quite competitive. It depends on the school, it depends on the year, but roughly on average, there are approximately between 70 to 100 applications per seat. So you can imagine what level of academic aspirations you should be aiming towards. Generally, students are advised to aim for the top 5% of their class. You're advised to have an extracurricular portfolio that puts you in that similar ranking as well. But to be brief, yes, it is competitive, but that's part of the process. And frankly, you want it to be competitive because you want the best students as doctors. So to be short, yes, it is competitive.
Sure. Could you highlight maybe any requirements, some specific requirements to get into medical school?
Yeah, so there's a few basic requirements, and these are universal for both Canada and the United States, if you're curious. So the first thing is you need to graduate some level of, I shouldn't say graduate, you need to have some university undergraduate education. I say you don't have to graduate because some students apply either in second year or third year or fourth year, but you do need to have some undergraduate university training. So that's a bachelor's degree, at least somewhere you need to start that. That's a big difference from Canada and some of the other international destinations. So you cannot enter medical school directly after high school if you want to study in Canada or the United States. That has its advantages and, of course, disadvantages. So that's the first requirement. You need to have some undergraduate training. The second thing is you need to write an exam called the Medical College Admittance Test, the MCAT or MCAT. This is a very long and very grueling exam. It is the bane of existence of every medical student. We all hate it, but it's a very long exam and it's a very important exam because you're ranking. So the exam ranks you relative to other applicants. So if it's a very hard application year and they write a very hard exam, it's okay if you don't do too well because it's relative to everyone else. But in general, you do need to rank relatively high among your colleagues to have a chance of getting into medical school. In Canada, we're not so focused on that MCAT standing. So in most schools, you have to pass a baseline threshold. You have to have a certain above a certain score for every category, and then you're considered to have met that requirement. In the United States, it's a little different. So there, they actually take that MCAT score, and it's a competitive score, meaning if I'm dealing with two applications and one has a better score than the other, they'll take the better MCAT score. So that's MCAT. So undergraduate MCAT. The third thing is, and these are now slightly less formal requirements, but still very important nonetheless, you need a very strong extracurricular portfolio. You have to have done something outside of the classroom that's noteworthy, be it research, be it social justice work, be it music, be it something. You have to have done something that makes you stand out from your colleagues, and you need to be able to put that in a story, in an application, and get that across. So once you've met those requirements, you'll submit an application and then you'll be called in for an interview where you're asked a whole bunch of other questions about when your personality is assessed. And at the end of that entire process, finally, you get into medical school and you go forward from there. It's a long
Oh,
process.
right. It seems like they choose best of the best,
Well,
right?
yeah, they try, but obviously some people sneak through, but
All
that's
right.
what they claim.
I see. So, I've also heard from you actually that now, even as a student, you are in contact with COVID, right, issues, and you are to do something with that. Could you highlight that also because that's really interesting?
Yeah, so it depends on the student's comfort level. So this isn't a mandatory portion of our training, but you might have seen around the world that as the healthcare systems get strained to their limits, the next sort of group of people that are available to help are the medical students. So a lot of medical students volunteered as screeners. So for example, when people are entering a hospital, we would do a very quick assessment to see if they have any symptoms consistent with COVID, and if they do, to make sure that they go to that appropriate assessment rather than going in with the general population. Some of my colleagues, we've begun taking cursory roles in the wards, and the most popular option for helping out during COVID, in addition to personalized things, for example, like research, which we can talk about later, which is my big contribution, was working with contact tracing. So this is hugely important, and certainly we've seen where governments fail to enact proper contact tracing, infections just go higher and higher. It's an incredibly cheap way of making sure that you contain an infection. What that entails is if someone gets an infection, you find that person, you identify whomever they might have come into contact with, you in turn contact those people and let them know, hey, you need to get tested immediately. And if we are suspecting these people are showing symptoms or that they may be infected, you start that process again. They're now your patient zero, and you find everyone that
Right.
they've come into contact with. So it's a never ending process, but it's certainly something that students can make a contribution with. And that's what a lot of myself and my colleagues have been doing.
All right. So, and you've mentioned the research project also. So that was the one which you've just covered, right? When you study patients, right, and you know more about them.
Yeah, so that's contact tracing, but another big thing that a lot of medical students, if not, if I might be so bold as to say all medical students have at some level, is research. Even if we're not aspiring to a career in academic medicine, even if we don't want to become a professor and do research full time, a lot of medical students have some research experience for application purposes or just to have as a sort of checkbox. Now, I've treated that somewhat differently. I genuinely enjoy research, so I tend to do a little bit more of it than perhaps my colleagues do. But that's just my big contribution during COVID. My lab and myself, we were looking for ways to control the inflammation that happens after COVID infections. So we were looking to see if we can use any of our existing drugs in the capacity of COVID patients to modulate that inflammation. So you'll find a lot of these stories among medical students. All of us have some cool research that we're doing, so in addition to learning about medicine, to also push back the frontiers of medicine just a little bit as well.
Well, that's so much exciting. So, and to be honest, right now, I just want to express how I personally appreciate what you've just told and what you're doing with your fellow students. So, that's incredible. Thanks for
Thank you.
sharing. So, I guess for those who are watching this video now, it would be also very interesting and exciting to know. Well, let's get back to the study process. We've received many questions from students, from their parents, and we are actually really curious in the study process. How would you describe the study process in your university, in your medical school, how everything is organized, maybe how the study year, the school year is organized, maybe something about the breaks, something about the lessons itself. So, too many
Sure.
questions in one. Sorry for
Yeah.
that.
No, no, not at all. It's a broad question, but it's an important one. So the first and the most fundamental difference between medical school and your regular undergraduate programs, at least at the University of Toronto, is that your year becomes scheduled around blocks. So I saw one of your questions later. A student asked, how many courses do you take? Technically, I take one course per year, but that one course has many, many different elements to it. So, for example, right now we're studying our neurology block. So that's all we're doing for the next 6 weeks, purely neurology. But within that block, there's neuroanatomy that we have to learn. There's clinical skills that we have to learn. For example, what if a patient presents with a stroke or a seizure or a migraine or etc., what will they present with and how can you find them? Then how do you examine that patient and make sure it's not something else? And then there's, of course, the actual medical lessons that we have to learn, right? What are the disease pathologies? There's drugs that we have to learn about. So a lot of little elements within that one course. So a lot of people say, oh, you're only taking one course. That's so easy.
Right.
It's not quite as easy as it sounds. So I've just given you a quick summary of the sort of broad categories. Let me just show you or let me tell you what a typical week will look like. So in a typical week, we'll have some level of anatomy. Before COVID, that meant going into the anatomy lab, doing dissections, learning about the different relevant areas to make sure that we understand the actual lessons. So part two, speaking of that, lessons, right? We have lectures where professors, very eminent professors usually for the University of Toronto, most of whom have discovered a lot of the elements that we're actually learning about, they will go over the diseases that we need to know, the normal states, the disease states, and how to treat those. And that's our typical lectures. In addition to that, we'll have something called a case-based learning. So there's a lot of elements outside of the lecture that are highly relevant for the students to appreciate. And that's what the case-based learning is about. So we get a module. This module describes a patient. So there's no answers. It just says this patient comes in, they have this, 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 and this. And then they have a conversation, right? So it's presented exactly as you would with a regular person. The one line says, hi, I'm, Dr. Amindu. Welcome to the emergency room. How can I help you? And the patient will respond, and then the doctor will respond, and we would just read that. And then from there, we have a whole bunch of questions that we work together as a group. And the idea is that you just get a bunch of medical students together and let them debate these things and hash it out. And occasionally we have disagreements about what to do. Occasionally we have disagreements about what treatment courses we think are best. So we go through that. And then once we come up with our answers, we then have a second case-based learning session with a faculty member, so an expert doctor in that field, who then tells us, what they think is the right answer, what we think is the wrong answer. And that's a very interesting process. For example, a few weeks ago in rheumatology, I was absolutely certain that when a patient was given this presentation, we would test them for a given antibody called an anti-nuclear antibody, an ANA test. I was certain that was right, and I was convincing my colleagues, this is right, blah, blah, blah. And then we went to the doctor, and then they said, no, that's completely wrong, because if you test this patient and it comes back positive, you've now completely muddled the diagnosis. And so those are the kinds of things that you gain from experience, and that's what the case-based learning is for. Then we have clinical skills, right, where we have a large module set to do, but this is all about learning what to look out for and then how to test people. So for example, you might see, doctors doing all these things like tapping, use their stethoscopes, right? You may see manipulating people's hands and all of these little exam techniques. So that's what we learn in clinical skills. That's a half day. That's a very long class, especially on an online setting, which is not normal. We used to do all of this in person. But so that's all about learning the practical skills of becoming a doctor. And then that's where usually patients will come in and you would interview the patients and you would get a little bit more of a taste for all of those. So that's what a typical week looks like. You can imagine each of those things that I described to you has its own assessment. Clinical skills are assessed in a final thing called an OSCE, which is a practical exam. You walk into a room, you read a prompt, you do the exam, you leave the room, and you do it over and over again. We have regular exams, so regular multiple choice short answer exams for the lecture content, which are quite scary. We then also have things called bell ringers, which are for anatomy. And what happens there is you see a sample, there's a pin in the sample, and the thing will say, what is this? What does it do? What pathologies are associated with it? Anything you can think of for that particular sample. You answer that question. You have a minute to answer that question, and then you move on to the next station where there's another sample, another pin, and another set of questions. So that's the life of a medical student. Not again easy, but there are obviously multiple elements that you want to make sure that your doctors know, and this is the best way that the University of Toronto has decided is appropriate to teach that. You also asked about breaks. I'll mention that quickly. So for the first 2 years of medical school, we follow a regular academic calendar. So we go to school from just before September. Most schools start in September in the Western Hemisphere. We start in August, and we go from August to roughly the end of July, the end of June. So we have our summer break from July and August. The first 2 years, we follow that routine. Keep in mind that most students will be doing research during that summer break. You don't get to have fun anymore when you're in your summers. And then for the last 2 years, we have a very different schedule that's all based around clinic. And so we no longer get that fun academic summer break. Now it's more or less continuous. And then that's the way, of course, for the rest of your career as you go into practice medicine. There are smaller breaks throughout the year. For example, for the holidays, for Christmas, we have 2 reading weeks, one for the fall semester, one for the winter semester, but not too much time off, to be completely honest.
I see. So, well, it sounds for sure that's really interesting, and that's I would say that might be really different from what many of those students who will see this video might be used to doing in their universities, maybe, or it's about their way of studying in general. Maybe you have some pictures to share to illustrate what you've just said, just told
Sure,
about, right?
sure. So let me just get this open. So I hope you can see this. So this is what a typical lecture will look like. So these happens more or less for 3 to 5 hours a week, usually on the 3 hour side. But again, we have a consistent block of lectures. This is where we learn all of the relevant medical facts that you can't really learn anywhere else. This, just for your information, is our whole class. So at the University of Toronto, there's about 260 medical students. And so that's what we all look like when we're put in one place together. And you'll note the most important feature of this picture are the backpacks. Every year, the Canadian Medical Association gives all medical students in Canada a specific colored backpack. So we can always tell what year our colleagues are in and if they're a medical student, depending on the backpack that they're carrying. Just a fun fact for you.
Yeah.
This is one of our typical study buildings. Now, this is the research project that I was talking to you about. This is my friend Ross. So this is what my research looked like. And this is purely mine. This is not representative of my other colleagues. Some of them do research on a computer. Some of them do research in a library. Other people do research in hospitals, talking to patients. Mine is based in a lab, obviously, because mine is a little bit more basic science based, meaning it's more fundamental research. So this is what my research looks like. And finally, this is what a simulation will look like. So this is the clinical skills we were talking about. And so, for example, these folks are learning neonatal care. And obviously, before you get to touch real babies, you need to make sure that you're not hurting them. And so we practice a lot with dummies and simulations. And where possible, we practice with real patients. So, for example, if we're studying a specific disease set, for example, like cardiology, we will get cardiac patients to come in and we will listen to their hearts. We will do as much as we can with them so that we know what to look out for when we're put into a place with real patients where we don't know what they're coming in with.
Yeah, so that's incredible. And by the way, you've already mentioned that some of your lectures are online now due to the situation with COVID and everything. Could you please a bit tell us about the online study at U of T in your medical school
Yeah.
now?
So medical schools were a little bit archaic in the sense that compared to some other online schooling options, medical schools generally, as an institution, don't tend to offer that. Um, Everything that we did was pretty much in person. And that can be quite frustrating for students because, for example, not every specialist is available everywhere close by. So, for example, if you're studying something quite obscure, like, for example, rheumatology or hematology, there are only so many hematologists that are qualified to teach students in the city of Toronto. So there have been times where my colleagues and I we would get on the subway, the metro in Toronto, and we would get on there, go for an hour. So it was frustrating at times. So medical schools as a whole tend to be very much in person. The exception is, of course, COVID. You can't do in person anymore. So a lot of things have now been done online. For example, clinical skills have been online, where before we were touching patients and manipulating them, now we talk to patients, which is not the same thing. If you talk to med students as a whole, I think most of us will agree that the lack of clinical skills training is something that we're concerned about the most. Of course, there'll be plenty of other opportunities in the future for us to learn these skills, but that's something that all of us have a little bit of trepidation about. So the short answer to your question is more or less, at least at the University of Toronto, everything is now online. That has advantages, yes, but huge disadvantages from a medical setting. I think as your students are looking forward to their own medical training, I would not anticipate a lot of online education. Most of it will be in person, so you need to get ready for those early morning commutes. I, for
Yeah.
example, used to take the 5 o'clock train from my home to get to the university on time. So that will happen. You will have early mornings and late nights, but that's unfortunately par for the course.
All right, I see. Well, you've shared so many incredible things already, and now I'm even even more excited to know about assignments, to know about exams, how they are organized. Earlier, you've told me about the system which I would never imagine by myself of assessing future doctors, right? Could you share a bit more about the exams and the assessment?
Yeah, so it's a very good question and unfortunately a very long answer. The ultimate reality of this is that there are multiple elements that make up a good doctor. There are your basic medical skills, yes, right? So your understanding of medical knowledge. There's your fundamental skills, your practical skills about listening to hearts and touching livers and all of these other things. And then there's the basic sort of professionalism, how you behave, because all of those elements are fundamental to your performance as a doctor. So, speaking about medical knowledge, medical schools have exams, just like any other university. These are, again, as we've already discussed, these can be online multiple choice exams. These can be short answer exams. These can be those bell ringers, which all of us are terrified of. There's multiple assessments for the practical classroom medical knowledge. And then there's the clinical skills assessments. So those are things that are done, as I described earlier, in a practical way. So you walk into a room, that room will say, perform a cardiac exam on this patient. And then there'll be a patient in the room and an examiner. You walk in, you do the whole introduction, you make sure your hands are clean, you sanitize your hands, and then you go through the procedures, the movements of the cardiac exam. And you have a given set of, I think it's 7 minutes to do that exam. 7 minutes is over, you go to the next room. It'll say, for example, percuss this patient for a gastrointestinal issue, right? And then you would do that procedure exactly as you would supposed to, and you go to the next room. And that's also quite scary for a lot of students. But again, these are fundamental skills that you have to assess. And then there's that third category, the professionalism assessments. And now the scary part is, and this is not meant to put you off of medical school, but the scary part is that you're always constantly being assessed for this. So, for example, if you're constantly showing up late to class, now you can still get 100% on the exam because you take good notes or you get it from a friend or whatever, but you will get marks off for professionalism. And if that's consistently an issue, then that starts to cause concerns for you. And that's very different from a regular undergraduate or regular university training. If you're studying chemistry, you can show up or not show up to lectures. That's your problem because that will be reflected in your final mark. That's not so for medical school. If you're, for example, behaving inappropriately with your colleagues, right? If you're too aggressive or too timid, uh, that's a concern, and those will be noted in your professionalism assessments. Um, so it can be intimidating. In a way, you are always being watched. But in another way, it's relevant because this is how ultimately future doctors are going to have to behave all the time. So it's good now that we have that training to have that sort of safety net to make sure that we know how to behave and what to do. So multiple kinds of assessment, multiple tests. Um, I'll also add very quickly that there are very few times where you can sort of turn off and relax. Um, there are exams frequently, at least at the University of Toronto. It's not like a final exam situation for a typical university course where you have a midterm and then nothing and then a final. We have exams, if not every other week. We have some sort of major assessment at least once every 2 weeks ish. And then we have assignments, those case-based learnings every single week that are submitted every week on time. So it's a little bit stressful. Actually, no, it's very stressful. But you learn to live with it, and it's part of the training to make you a good doctor, hopefully. So, unfortunately, a long answer.
Well, but so detailed and I guess so informative. Also, in general, in Canada, it's pretty common to give students kind of teamwork where they have to co-work with their mates, with their peers, right, and produce kind of a project. Whether anything like that is common for a medical school, what kind of teamwork do you usually have there?
Yeah, it's a very good question. So, medicine before in the 80s, 1970s, uh, up until much earlier than that, for thousands of years, used to be an individualized profession. So you had a doctor, the doctor said something, you did that, you got better. That was the paradigm. But in the last decades, medicine has been changing fundamentally. Medicine is now a team-based endeavor, at least in the West. So, for example, in managing complex patient, yes, there's a doctor and they're ultimately responsible, but there are pharmacists, social workers, physiotherapists. You might have consulting specialists, right? So you start to form this very complex web that the doctor is at the middle of with the patient, but then you have more and more of these people around you. So working together in a team, recognizing your own limitations, recognizing that there are others who may know things more than you in this context, all of those are fundamental skills for a doctor to have. And so there is an element of team-based learning throughout most, if not all, medical schools. So at the University of Toronto, it's the case-based learning. That's the main sort of teamwork that we do. And this is every week. So we have 4 hours every week where we meet together among students. We discuss stuff, we debate stuff, we answer questions. And then 4 more hours where we meet with the same group of students plus the expert, and we do the same thing again. And then we go through the expert's view of the questions and answers as well. So, it's challenging at times, especially when you have multiple competing opinions. All med students tend to be type A personalities, right? We all think we're the smartest. Not really, of course. We of course defer to our colleagues and our mentors, but we always have most of us tend to have strong opinions. And when those opinions are challenged, it can get a little bit interesting. But that's part of learning to become a doctor. And so certainly it might seem a little bit annoying, especially if you're not used to it, but it's very fun, it's engaging, and it's a good way to learn things that you otherwise wouldn't. It's learning from each other in addition to learning from the experts.
All right. So again, that's just, I don't know, astonishing, right? Because it's interesting because that's the real life, right? And it's so much, I would say, again, incredible just how much real life is there in this study, right? And that's impressive. Well, if we get back to some more impressive things, right, in terms of the study, there is another question from one of our medical students from Russia. Darius is interested in practical training. When do you start doing like real practical training, right? And whether there are some particular requirements for that, or is it anyhow assessed? So, what could you say about the practical stuff?
Yeah, it's another great question. So practical training starts at the end of second year. So third year and fourth year. So medical school is 4 years in the West, largely. There are one or two schools that offer a 3 year program, but it's pretty much 4 years. The 3 year schools just eliminate their summers. So it's pretty much 4 years for everybody. And the way it works is for the first 2 years, you have the classroom training that I've been describing. And then for the last 2 years, you have the practical, the clerkship training, as it's called. So for the first 2 years, you're a pre-clerk, and then you become a medical clerk. Clerks are in hospitals all the time, pretty much. And what you do is you learn, you apply everything that we just discussed now in a hospital setting. So that's one opportunity for practical learning. But the only exception is you can't just come in for the clerkship years. So you can't come in with your medical training and say, hey, I want to be a medical clerk. You have to go through years 1, 2, 3, and 4. So after that is a process called residency. So at the end of medical school, you're given your MD, you're officially called a doctor, but you're still not allowed to do anything on your own because you have to do residency next. So this is what in the UK you're called a junior doctor. So you're in a hospital, you have some responsibility, but you're under the supervision of a more senior doctor and a more senior medical team. And so you would complete that residency. Now that depends entirely on what kind of doctor you want to be. If you want to be a family doctor, your residency is about 2 years. If you want to be a neurologist, it can be 5 years. If you want to be a surgeon, it can be 5, 6, 7 years. Depends entirely on what kind of doctor you want to be. But that's where you really get the fundamental little itty bitty details of the kind of profession that you are going into. So that's where I think Darius can look into continue his training in Canada and indeed all around the world. There's certainly a lot of exchanging that happens at the end of medical school. It's not uncommon for a student to do residency in the same school that they did their training in, but I think it's fair to say that more students tend to look beyond their school to do their residency programs. So that's certainly one opportunity for practical learning. And then at the end of residency, there's another opportunity for practical learning called a fellowship. Now, these tend to be extremely specific things for people who want to do some very specific training. For example, if you want to become a pediatric transplant surgeon, you can do a fellowship in pediatric transplant. If you want to, for example, be an endovascular surgeon, right, someone who clears out the arteries and veins of the body, you can do a fellowship in that very specific procedure. So this depends on your personal preference. You know, if you want to do more school after that, even though it's not really school because you're just in a hospital, but in a different setting. But that's another opportunity for practical learning. So the short answer is there's lots of practical learning in your medical school, but after that you can do some in residency, and after that you can do some more in fellowship, should you wish. So lots of opportunity for practical learning.
Well, Amanda, thank you so much for telling us today so much. Right, I guess it's very inspiring for some of students who are watching this video today. Well, as for you, we really appreciate what you do, what you're doing now, right? And thank you so much for sharing your experience with us today.
Of
So,
course.
um,
I appreciate your kind words there, Victoria. But just one more point is that yes, medicine is a very difficult academic journey. Medical medicine as a career is very difficult as well. You will see things and do things and experience things that will question your fundamental humanity, that will make you question your life choices. It's difficult. And I don't think there's any point in trying to deny that or trying to soften that blow. This will be a very difficult journey, but it's an incredibly rewarding journey. There are times where, you know, people are on the brink of death and you can bring them back, or people have some horrible debilitating condition and you can help them. And there is no better thing, in my opinion at least, that you can do as a human being than to do that. So yes, there are huge, enormous challenges, academic, personal. You'll sacrifice a great deal. It's also quite a financial investment as well. Medical schools are one of the most expensive schools that you can go to, with one exception, which is dental school, which tends to be a little bit more expensive, but that's another story for another day. It's a huge investment. It will cost you a lot in every way that a human can be challenged or tested, not just exams, personally, emotionally, socially, in every way. But at the end of it, you will get something that, at least in my opinion, is worth all of that. And that's the question that you need to ask yourself as well. If you're going into medical school to make someone else happy, to make your parents happy, don't do it, because it's not going to be worth it. At the end of it, you're going to go through these struggles. And if you don't have that motivation to push you forward, if there's nothing you're reaching for, that's going to be a terrible, terrible experience for you. The other thing is, if you're going into medicine for the money, please don't. There are so many other professions that you can earn a lot more money a lot quicker than medicine. And it's going to take so much out of you to earn that supposed doctor's salary. So if you're doing this for the right reasons, you will find the motivation, but it is a difficult, difficult journey. And certainly there's a lot of help for you along that journey once you get started. But the big step is getting into medical school, and it's a hard journey. It's a grueling journey. I was rejected from medical schools. Every colleague of mine, I'm sure, except for maybe one or two very rare exceptions, was rejected from at least one medical school that they applied to. So don't let that get you down. It's not about the application, it's about the journey that counts. And it may take one application cycle, it may take two. As for many of my colleagues, it took three. There's one person I know who took six applications to get in, but they were so determined to get into medicine, they just kept applying, kept boosting their resume, kept doing that MCAT again and again to make sure they had the sufficient marks. So it's a long journey, but I wish you the best if you're doing this for the right reasons. And if you are, I'm sure at the end of it, you will have something truly of some value, as Victoria so kindly pointed out.
well, thank you, Minda, so much. Well, for your inspiring speech, for everything you do, right, for coming today and sharing. Well, really, really grateful. So, thank you. I'll see you.
Very welcome. Goodbye.
Thank you.
Thank you.
Bye bye. Dear students and parents, thank you for watching this video. We hope you really enjoyed knowing more about medical study in Canada. We also recommend you to share this video with those who are interested in this topic, and don't forget to subscribe to our channel not to miss our next interview with another student of a Canadian college and university. If you have any questions about studying in Canada, in the UK or the USA, please leave your comments or send us your questions to email canada@educatconsulting.com. We'll be happy to find the proper school for you personally, and our team will provide you any help you need with enrolling into a Canadian university. So, see you in the next video. Bye.